This entry in the Clinical Toxicology series is about hallucinogens, corresponding to Goldfrank's Chapter 79. The learning objectives for this session are that you'll be able to identify at least 2 chemical classes of hallucinogenic drugs and name at least 3 distinct specific hallucinogens. Hallucinogens as a drug class are defined by a particular effect rather than by their mechanism. Hallucinogens are a diverse group of xenobiotics that distort perception, thought, and mood while generally preserving the user's sensorium and awareness, meaning that they will be perceiving things in an abnormal way that presumably they are intending and hoping will be pleasurable. There are multiple chemical classes of hallucinogens as listed on this slide, and we'll be briefly discussing several of these over the next few slides. The lysergamides include LSD, lysergic acid diethylamide, which is synthetic, as well as a few other plant-derived compounds, as found, for example, in the seeds of the Hawaiian baby woodrose and morning glory. The psychedelic illustration on the left side depicts Albert Hofmann, who first synthesized LSD in 1936 and first used the drug in 1943. We can see that part of the structure of LSD closely resembles serotonin, and it's believed that the hallucinogenic effects of the lysergamides and a few other hallucinogens relate to serotonin receptor agonism. Next up are the indole alkamines. These include psilocybin, psilocin, bufotenin, and we also see here how this class includes endogenous serotonin and melatonin. Psilocybin is found in a few mushroom species ingested for their hallucinogenic potential. The psilocybin is metabolized, dephosphorylated, into psilocin, which is a serotonin 2A agonist. And if you've ever heard of people licking toads, it's because bufotenin is the hallucinogen that bufo toads produce. And while it's true that these toads do make potentially hallucinogenic substances, they also produce cardioactive steroids, and I'd be a lot more worried about serious cardiotoxicity, so no toad licking for me. The phenylethylamines include mescaline, derived from the peyote cactus, as well as some synthetic hallucinogens like MDMA. In fact, all of the amphetamines are also phenylethylamines, and we can see the close chemical homology they have to endogenous catecholamines, such as the example of epinephrine pictured on the right-hand side. In overdose situations, then, we'd expect to see prominent sympathomimetic effects. Several other plant-derived hallucinogens exist, including Salvia divinorum, whose psychoactive compounds are the salvinorins, which are kappa opiate receptor agonists. Kratom is derived from the leaves of the tree Mitragyna speciosa. The active ingredient here, mitragynine, produces some mild stimulant effects and is an agonist at mu, delta, and kappa opiate receptors. Nutmeg contains myristicin, which is reputed to have hallucinogenic and euphoriant properties, and belladonna alkaloids, such as the scopolamine pictured here, might be taken for hallucinogenic effects, although the hallucinations would just be part of the neuropsychiatric effects seen with an anticholinergic toxidrome. Some people might like that. Now, you'll notice that I haven't spent much time explaining the hallucinogens in detail, and that's because hallucinogen users rarely seek medical care and rarely need any medical care. They'll be hallucinating and enjoying themselves. But complications are possible, such as someone having a bad trip and being so agitated that their friends bring them to the hospital for care. Or a patient might have exaggerated effects resulting in a sympathomimetic toxidrome or an anticholinergic toxidrome. And for the most part, these patients will need symptomatic and supportive care, addressing any abnormal vital signs, and if any pharmacotherapy is needed to help control agitation, then benzodiazepines are the first-line drugs. All right, and that's it for the hallucinogens. I'll be seeing you around.